Well, hello, my name is Dr. Lynn. I'd like to welcome you to the video. Today I'm going to be talking about the intestinal assessment markers and why it's so important to have this test done. This is probably the most important test that I run on patients because it just gives me so much valuable information about the status of someone's health. Now, what is really important for you to understand is you can have a GI problem, an intestinal tract problem, a stomach problem, and not even know it. I mean, you can have infections, you can have dysbiosis, you can have inflammation going on, and you don't even know it. And then there's the overt symptoms that you can get, like gas, bloating, indigestion, heartburn, pain. Those are obvious, but a lot of the time there are no symptoms. So that's why it's important to check it out and see what's going on there. All right, so why is it so? Let's talk about why it's so important to do this test. And before we go into it, I have to give you a little bit of a review of the histology and the anatomy of the GI tract, the intestine, stomach, things of this nature. Of course, the intestinal tract is responsible for absorbing our nutrients, our fluids, our hormones, vitamins, minerals, pretty much everything. All right, now the lining of the intestine is one cell layer thick, and that's it. Underneath that layer of cells is what's called secretory IgA. That is your first line of defense. It's your immune system. 80% of your immune system is in your gut. So that's important to understand too. That's where your immune system's linked, so it can catch all the critters and toxins that are trying to get in your body through that one cellular thick membrane. Okay? Now there is a concept out there, there's a problem called leaky gut syndrome. This is where you have hyperpermeability. You start absorbing the wrong things like large molecules of protein, toxins, organisms that aren't supposed to pass through that one cellular thick lining. It gets through because it's been inflamed, or you've had dysbiosis, you've taken medications, you had a bad diet, drank alcohol, causes that hyperpermeability of the lining. And that's a big problem because that is the gateway to disease. They're doing research all the time, and they're finding out from studies that this is a huge cause of autoimmune disease, not to mention other issues. All right, so let's go through this kind of quick. I'm not going to overwhelm you, but let's assume that you are, say, gluten sensitive. It's a protein in wheat. Your GI tract, your SIG-A, your secretory IgA is going to recognize that protein as a foreign invader. It's going to promote an immune response, specifically a cytokine, a chemical, it's an inflammatory chemical, IL-17. Okay? Then it's going to call in more immune system cells to try to attack and take care of this gluten protein. It's like a foreign protein to the body. All right, so you have this huge immune response, a huge inflammatory response, and this is going to make the cell line, the lining of the intestinal tract even more permeable. And these antigen antibody complexes, these reactions from the immune system, they're going to make complexes. They're called immune complexes. They're going to seep through the lining of the intestine. It's going to get into the bloodstream. Now these immune system complexes are floating around in your bloodstream. Now what happens is your immune system is going to start looking around for a similar structured protein in your body. It's called molecular mimicry. So anything that looks like gluten, your immune system is going to try to attack that too. And in this particular example, the gluten molecule, the gliadin protein in gluten, looks like thyroid gland cells, the receptors. So guess what? Your immune system is going to attack your thyroid gland. And this is how you get autoimmune thyroiditis like Hashimoto's, Graves' disease, things of this nature. Now, another one would be rheumatoid arthritis. This is when you get an infection with an organism called Proteus, Klebsiella, things like that. Those organisms look like your synovial membrane around your knees, your hands, your back, your neck. So guess what happens? Your immune system is going to throw antibodies at your synovial membranes. It's going to destroy your joints. Okay, so this is why it's so important to understand why to check this GI tract for any potential infections. Make sure that you don't have a lot of bad bacteria in there, anything like that. Okay, I wanted to get that concept across because that's the biggest thing. We're trying to prevent disease. We're trying to eradicate these infections and thereby helping the rest of the body calm down and stop attacking your own tissues. All right. Okay. So on the actual test, what are we actually testing for? This test, I wanted you to also know that this test is approved by the FDA. It does not do the Petri plate microscope thing. It tests for the DNA. It's very accurate, and there's a high confidence level with this type of testing. All right, so it tests for all kinds of pathogens, your usual viruses that cause acute diarrhea and things like that. Pathogenic bacteria. It's going to check for fungus like Candida albicans and other yeast infections. It's going to check out for any parasites that you may have. It's even going to check out opportunistic bacteria. Those are bacteria that are just waiting for an opportunity to grow and start causing problems. So we check that out. It's also going to be looking at your good bacteria to make sure you have enough of those. Many people have what's called the reverse of that. They have a lot of bad bacteria and low good bacteria. This is called dysbiosis, causes lots of problems. Now, it's also going to check other intestinal health markers like elastase 1, which is going to tell us if you have enough pancreatic enzymes released into the intestinal tract. It's going to check if you have any fat in your stool or too much fat, meaning that you're not getting enough bile out there. Okay? It's also going to check for an enzyme called glucuronidase. Now what this is, when you have dysbiosis, which is very common, you make this enzyme glucuronidase, and what it does, it's going to take your waste in your stool. It's going to let's start here. Let's say you detoxed your estrogen hormone. It's got released into your intestinal tract. It's ready to go into eliminate in the toilet. So let's say you have a dysbiosis. You release this enzyme. It's going to unwrap the wrapping around that estrogen, take it off, and you're going to reabsorb that estrogen. You're going to get more estrogen dominant, which it looks like everybody's starting to get estrogen dominant. Okay, and it starts increasing your risk for the estrogen metabolites that cause cancer and other problems. So it's important to take care of a dysbiosis and check your glucuronidase level. It's also going to check for that secretory IgA we were talking about. Is it too low or is it too high? It's nice to know. If it's too low, we're talking about leaky gut syndrome. We're also going to check for blood in the stool, occult blood, to see if there's any bleeding. And it's also going to check for inflammation. So, very important test. Pick up a lot of problems that can help people get better. What's the treatment for a lot of these things? Well, we have a lot of botanicals, we have a lot of supplements, herbs, certain vitamins that can help rid the intestinal tract of these infections, like silvercillin, we have oil of oregano, we have GI microbe X, monolaurin for viruses. The list goes on. So we can take care of these things. If we do see a really fulminant infections, of course, we're going to try to use antibiotics. All right. So let's go through the test so you can kind of get an idea of what it's about. Okay. Here, this is it right here. It's from Diagnostic Solutions. It's called the IMAP test. It's a stool test. Very simple to do at home. You just mail it out from your home, and then I get the results. It's gonna test again for all those pathogens: virus, parasitic, bacterial. It's going to check for H. pylori, which is very common in GERD and heartburn. Good thing to check out. And then it's going to check out for, it's going to check your normal bacteria flora. Do you have enough good bacteria? In this particular person, her good bacteria are too low. Okay, so she's starting to get a dysbiosis already. And this is a bad environment for your GI tract to be in because it'll cause hyperpermeability. Other infections can take over, and it's going to start releasing that glucuronidase enzyme. All right, it's going to go through the opportunistic bacteria and other dysbiotic bacterial overgrowth, other parasites, fungi, yeast, and excellent. Okay, then on the last page, it's going to go over the intestinal health markers. The elastase 1 tells us about the pancreas, the immune response of your GI tract with your secretory IgA. Are you inflamed? Are you releasing too much glucuronidase? And it's also going to test for zonulin, which is the actual chemical that causes leaky gut syndrome. Kind of like puts holes in your GI tract. Okay, so this is it in a nutshell. Oh wait, there's one more thing I wanted to tell you about. There's autoimmune triggers. The test is really good at finding out if you have infections that can trigger an autoimmune disease, like we said, rheumatoid arthritis, ankylosing spondylitis, psoriatic arthritis, Hashimoto's disease, systemic sclerosis or scleroderma, lupus, all those things. Okay, so we're going to be looking at those autoimmune triggers: Citrobacter, Proteus, Klebsiella. They're all associated with certain autoimmune diseases. Okay, they're looking for that similar molecule to get that immune system to attack. So we want to find these things out, hopefully in an early stage before things get worse. So if you have any questions, any concerns, you want to have the test, call our office, email us. It is part of our functional medicine package. Okay, I hope you enjoyed this video, and I hope it made some sense. Okay, thank you.